Man, I've been trying to do better with my eating, but wouldn't it be nice if you just wave a magic wand, lose a little bit of weight? It doesn't work that way, though.
No, lifestyle changes alone aren't always enough. It could be something like Orbera is appropriate. For patients struggling with obesity, it might be that bariatric surgery is best.
And Dr. Tom White, he does all this stuff, but at his center, he's got a team approach that's most impactful. Good to see you, Doctor. Thanks for stopping back again.
Nice to have you here.
Good to be here. Thank you.
Let's talk about your practice, though, because you have different, really a unique form of weight loss. What services are we talking about here?
Well, we originally started with the surgical weight loss options, and so that includes the lap band, the sleeve gastrectomy, as well as the Roux-en-Y gastric bypass. The new Orbera balloon is a great new option that's non-surgical. We place it endoscopically for people that maybe aren't quite as overweight as the ones that would need the surgical options.
May I see that?
Absolutely.
And we're looking at a picture of it here. So when you say it's a balloon, it really is. I mean, it's kind of squishy, like a balloon would be, a water balloon. And you put it into the stomach. How?
We use an endoscope, so that's basically a lighted tube that we look into the stomach, and the balloon comes rolled up like a little cigar, as you can see on the animated picture here, slides down the esophagus, we watch it go down, put the balloon into the stomach, and inflate it with 600 cc's of saline or just salt water.
And it stays in the stomach for how long?
Correct. It's intended to stay in for 6 months, so it's the FDA requires us to go back in at 6 months, take that out, and at that time, typically we'll see about a 30 to 40% excess body weight loss. So if somebody is 100 pounds over their ideal weight, they would lose 30 to 40 pounds in 6 months.
Wow.
Wow, this is incredible. I mean, the balloon itself, like you said, you shrink this down. You take all the solution out, and put it down the throat, into the stomach, and then blow it up again. How do you know if you're a good candidate for this?
The typical candidates we look at are BMIs of 30 to 40. So BMI is a body mass index. Typically corresponds to a female that be maybe 180 to 190 pounds up to around 270 pounds. And so men a little bit heavier for their average BMI would be average man of 215, 220 up to 270 pounds.
You are the only doctor in our area who's performing this procedure. What kind of success have you seen so far?
We're just coming up this week, actually going to take the first one out. So 6 months has already come and gone on the first patient. Her initial weight was around 215 to 220 pounds. She's now down to around 175.
Wow. How does she feel? Because it's not just about the way we look. We know when we lose weight, other things start to change.
She feels great. I mean, you get that, it really takes 40, 50 pounds off once you're 100 pounds your ideal weight to make the health issues go away. And so she feels great. She's actually thinking about having another balloon put back in.
What about the safety of something like this?
Very safe. There are risks with anything you do, but this has the least amount of risks of any device that we use for weight loss.
You said she's thinking about doing it again.
Correct.
So she would be a candidate a second time. The FDA says with this device, it's got to come out after 6 months.
Correct.
But you could go back in for a second round and lose additional weight if you weren't a candidate for bariatric surgery in the beginning, let's say.
Absolutely. The FDA wants us to take these out at 6 months because there is some risk that that balloon may rupture. If it ruptures, it's not going to hurt anything because it's just salt water. But that balloon may go down and cause potentially a small bowel obstruction. Typically, it would just pass on through. But they want us to take that out, but you can't put another balloon back in at 6 months.
Go back in.
You know, one of the things we talked about with you is that team approach that you take at your clinic, whether it's Orbera or bariatric. Why is that team philosophy so important?
Well, any procedure out there, if you don't change some of the habits that you're accustomed to or what types of foods to eat and how to eat, you can regain a lot of your weight, if not all your weight. So we really use that 6 to 12 months that after we put the balloon in to try and educate people on how to make small changes in their life and how to add maybe some types of additional exercise into their life to make them successful lifelong. Mary mentioned her neighbor, Katie Worth, who does a great job. She's been our nurse coordinator now for around 6 years, I believe. And so she'll meet with people anytime they want. We've got a dietitian, we've got a doctor of pharmacy that maybe we're going to add some drug loss drugs down the road, which have there's some new drugs out that actually add some benefit down the road after we take the balloon out.
So who are some of the other professionals on your team? In addition to Katie, what are their titles, and then what is their interaction like with patients?
So I have a physician assistant that works with me. She's been with me for around 19 years now. She's very important in the preoperative education, postoperative follow-up. We've also got 2 nurse navigators that will help with the different insurance issues for the surgical procedures. There's a whole, a lot of people that will work in the hospital side as well. So the nurses that are used to take care of these patients in the hospital, as well as the operating room crew that are there, and they'd work with me on every single case.
What are the stages of Orbera? I mean, you pick up the phone, you call, is there a consult, and then from that point on until it's put in the belly, what's the time frame there?
The time frame for the Orbera is shorter because right now it's not covered by insurance, so we can eliminate the insurance waiting time. which is nice for the patient, but the downside is the insurance won't cover any part of the balloon. So typically it takes anywhere from 2 to 4 weeks at the quickest scenario to get the balloon put in.
Gotcha.
Website, well, let's look at this information because it's going to make more sense for you to just call and make your appointments for Orbera, or maybe you want to look at some other options. Dr. White does it all, and you've got 2 locations to choose from. So which one is closest to you? The numbers there respective to those locations. And I think about this team approach. It makes a difference in the outcome for the patient, and that's the whole. You don't do all of this because it's easy.
Right.
It's because it's better for the patient in the end.
Absolutely, yeah. And the company, to their credit, they've only sold this device to programs that have a whole managed weight loss program in place.
Yeah.
So,
So you're not just putting this in and forgetting
Right.
about it. Yeah.
Omaha Gastric Balloon.
I'll give you the balloon back,
all
Doctor.
right.
Thanks for
Thanks,
coming in
Dr.
today.
White.
Thank
Good
you.
to see you.
Guest of the morning blend.